Traditionally, cancer medicine has focused on detecting and treating tumors once they've already formed. This approach has saved countless lives and has improved dramatically in recent decades, and we should absolutely acknowledge that. But there's a paradigm shift happening in cancer science, a movement toward ultra-early prevention, attempting to stop cancer not at the tumor stage, not even at the visible precancerous cell stage, but at the stage of initial molecular changes occurring in cells that still look completely normal. This is a revolution in how we think about cancer, and it has enormous implications for skin cancer prevention. Instead of waiting for a tumor to appear and then trying to eliminate it with surgery, chemotherapy, or radiation, imagine a future where we can identify cells that have taken the first steps toward cancer, when they've accumulated just one or two critical mutations, and we can intervene at that moment to push those cells back toward normalcy or eliminate them before they cause problems. This is preventive medicine at its most fundamental level. What would this look like in practice for skin cancer? It could involve regular screenings that detect specific molecular markers in skin samples, similar to how we now do routine blood tests. These markers could include specific mutation patterns, characteristic epigenetic changes, or abnormal levels of certain growth control proteins. If these markers are detected, indicating that certain areas of skin have accumulated significant molecular damage, preventive treatments could be applied. These treatments might be topical creams containing compounds that promote DNA repair or that selectively induce death in cells with specific mutations, or that reset dysregulated signaling pathways. It could also involve minimally invasive procedures that remove small areas of high-risk skin before they develop visible tumors. Some of these approaches are already in development or early clinical trials. There are studies testing whether certain topical compounds can reduce the number of actinic keratoses, which are common precancerous lesions in sun-damaged skin. There's research on whether certain systemic medications can reduce skin cancer risk in very high-risk individuals. There's development of advanced imaging techniques that can detect cellular changes before they're visible to the naked eye. This is happening now, not in some distant future. What's exciting about this ultra-early prevention approach is that it could potentially dramatically reduce the incidence of skin cancer. If we can stop the process at its first molecular stages, before a cell has accumulated enough mutations to become fully malignant, we could prevent tumor formation entirely. This is fundamentally different from current approaches that essentially wait for the disease to develop before intervening. However, there are also challenges we need to acknowledge. Accurately identifying which cells are on a definite path toward cancer and which might remain stable or even reverse is complicated. The risk of overtreatment, of intervening on cells that would never have caused problems, is real. There's also the practical question of how to implement this at scale. Who would receive these screenings and preventive treatments? How often? How do we balance costs and benefits? These are legitimate concerns that need to be worked out. Despite these challenges, the direction is clear. Cancer medicine is progressively moving toward earlier interventions, more personalized approaches, and greater grounding in detailed molecular understanding of how cancer begins. For skin cancer, this shift is particularly promising because skin is accessible, visible, and relatively easy to monitor and treat. We're not talking about trying to detect molecular changes in some deep internal organ. We're talking about an organ we can see and sample relatively easily. This accessibility makes skin cancer an ideal testing ground for these ultra-early prevention strategies, and the lessons learned could eventually apply to other cancer types as well.